you're on the road. So that means now you have to behave yourself unless you're trying to kill someone, and then we're all good to go. Um,
Yeah,
so
everything's on the record.
this is all ask questions. You guys run the show. Let's start talking about stuff, whatever you want to know, maybe about your story or something you saw on the news, or and everybody be sure and mute themselves so we don't have a lot of background noise. And there's Barbara; she's alive and well. Unless you're going to say something, mute yourself so that we don't have a lot of background noise. So there you go. All right, who wants to start? Who's got the first question about anything except you, Barbara? Uh-oh, Kathy.
So I'd love for you to talk about how Mother Nature, if you're going to try to use Mother Nature to hide your crime, I'd love for you to talk about that and how well that works or not.
Well, citizens and Mother Nature will screw up the perfect crime every time. Ask Scott Peterson and O.J. Simpson. They'll both tell you that. Um, in the Scott Peterson case, he drove 100 miles from home. He bought a boat that nobody knew he had bought and stored it in a storage place that nobody knew he had. But they're going to try to retry this guy. I mean, unbelievable. Who the hell else would have done this? And so he kills his wife and he takes her in the boat all the way down to the bay in San Francisco and dumps her. Well, that's great. She's gone. San Francisco Bay, she's gone forever. That's the Pacific Ocean, baby. Well, 3 months later, she popped up on shore along with the baby that had suffered what they call a coffin birth, where you get the gases of decomposition pushes the baby out. Very gruesome, but that's what happened. Yeah. So she and Connor were found on the shore. Well, lo and behold, it was 100 miles from home, and it's where Scott said he was. And he even had a parking ticket to prove he was there because he wanted to be 100 miles away from the crime. What he forgot is he was right next to the dump site. So Mother Nature just bit him in the butt. And now, how do you backtrack? How do you? I was just kidding. No, you got a parking ticket, you moron. You know, So, and in OJ's case, of course, he goes over there and gets Nicole out of the house. Well, Nicole left the front door open when she came out. The kids were upstairs asleep and everything was fine. He was going to kill her and go get on a plane and be in Chicago for the body was found by the kids the next morning, probably. That's cool. But Ron Goldman showed up and came through the gate, and they got in a fight, and he killed Goldman, and then he killed Nicole, and then he split and left blood evidence everywhere. Well, he left the gate open and the front door open. Nicole has a dog. What do dogs do when there's an open door? They go through it. So the dog comes down there and stomps around the crime scene, gets blood all over it, and walks down the street. And people are out walking late at night and they see this dog covered with blood. Say, what the hell is going on? Duh. They follow the dog back. So the bodies were found within 30, 45 minutes. So his whole time frame of getting out of Dodge and being in Chicago the next morning, for an ABC sports thing blew up. So best laid plans always go wrong. And so Mother Nature and serendipity and just citizens, how many times have you seen where someone witnessed something? And of course, nowadays you got video. I mean, there's video cameras everywhere. If you're going to dispose of a body, do not go to Walmart to get your materials. Because Walmart is one of the most carefully, it's like the Pentagon and the CIA. They got cameras everywhere, and it's just part of who they are. They keep track of everything that's going on their property. The parking lot, the checkout stands, the aisles, probably everywhere but the bathroom. So if you go into Walmart, you might as well be in a Las Vegas casino because you are being watched. So there you go. Don't go to Walmart and get your bleach and your plastic bags and your shovel.
I think you definitely.
Ask a question. Oh, sorry.
Yes.
No, go ahead, Jenny. I was just going to comment. Go ahead.
Thank you very much. Firstly, thank you very much for this free session. It's really kind of you. Appreciate it. In my work in progress, the victim is found dead under what looks like very suspicious circumstances. Later on, it's ruled as being natural causes when the pacemaker shows at the time of death is when the guy was on his own. In fact, he was actually poisoned with digoxin in his bedside water carafe, which brought on a heart attack sort of like an hour or so later. Is it feasible, do you think, in this day and age that the police would miss this?
It's possible, yes. I mean, it depends because it depends on the age of the person and all that. And what the if the person has a pacemaker and is taking digitalis, by definition, they have some form of heart disease, or they wouldn't be on that. So they would digitalis kills about one of two ways, really, in the heart. One is that it causes what's called a heart block, where the electricity doesn't get from the upper chamber to the lower chamber, and that slows the heart way down to enough that people can faint and hurt themselves or die. With a pacemaker, that's not going to happen because the pacemaker is not going to let the heart rate go low. But more treacherous with digitalis is it makes the heart irritable and jumpy, and it causes.
Sorry, is digitalis the same as digoxin then?
Yeah, same thing.
Oh, okay, right.
Yeah, it comes from the foxglove.
Yeah.
It's called Digitoxin, Digoxin, Digitech. They got a million names, but it's basically digitalis. And it's called a glycoside. But what it does, it makes the heart twitchy. It makes arrhythmias, PVCs, and then the deadly ones, ventricular tachycardia and ventricular fibrillation, which are very common causes of death in heart disease of many, many different types, from coronary disease to cardiomyopathies, disease of the heart muscles, to all kinds of things like that. And those types of ventricular arrhythmias that are very rapid lead to sudden death. So they could just write it off as that, especially if this is an older person. And I in my practice in cardiology, I've signed a lot of death certificates, and they were people that are 85 years old and they died at home, and they've had coronary disease, and we knew that they weren't going to be around much longer. Not a problem. Now, ultimately, the coroner has to sign off on that, but he usually accepts your thing because he doesn't want to spend the time and the money doing it. So a lot of these suspicious things do go by like that. But the other thing is that they could, when they test the body, if they do any kind of autopsy, any kind of toxicological testing at all, and the medications that they're on, they would test for digitalis to see if it was a player in the person's death. Okay. And they may find the level very, very, very high. Well, okay. Why? Well, older people get confused about their medicines all the time, and younger people are stupid because they think if one's good, three's better. It's amazing how many times I see that. So you can get digitalis toxicity where the normal therapeutic digitalis level is between 1 and 2. I've seen them 8, 9, 10 because people just started taking more or forgot. And now the other thing here is they may find it in the stomach, and that'll change everything. If there's a big dose or some undissolved pills or something like that in the stomach, then they might think it's a suicide attempt or accidental overdose or something like that. But the answer to your question is yes, you could get by with it. Right. One thing I'll point out, this is not a heart attack. A heart attack is called a myocardial infarction, and that's when a clot happens in an artery, shuts down blood supply to an area of the heart, and that area of the heart dies. That's a heart attack. What this is a cardiac arrhythmic death. It's a change in the heart rhythm. And most cardiac deaths are due to that.
Quick question.
Thank you. Thanks.
That's just somatics. Yeah, Michael.
Following up on Jenny's question, I have a mystery where I am doing absorbing poisons through the fingertips. Would that still be the same as the digitalis, or would that be a little offshoot?
Well, it's got to be a different drug because digitalis won't absorb through the skin. There's very few that will, but ask Kathy, sodium azide will. That fit into one of her books, and cyanide, of course, and fentanyl. Fentanyl absorbed through your skin too, or you just get it on your skin, on your finger. I mean, just rub your eye or lick your finger, or almost anything. It takes fentanyl is one of those things that a little dab will do you. and that's why cops go down all the time. They'll open up, they'll arrest some guy and get a bag and open it up. The next thing you know, the guy gets woozy and he goes down. And that's why they carry Narcan to reverse that thing now. Fentanyl is extremely dangerous. You may remember that the Chechen rebels overtook a theater in the Ukraine or Russia or something, and Russia sent their elite forces in because they were strapped with bombs and they were going to blow up like 500 people in this theater. And so the Russians kind of surrounded it, and this went on for hours, and they couldn't figure out how to solve this thing. So they finally pumped an aerosol of fentanyl into the building. And when the people inhaled it, they went down in a microsecond. It's that powerful and works that quickly. So much so that none of the rebels detonated their bombs. They didn't have time. They were unconscious. The downside is now they had to rush in and start saving all the other people. And I think over 200 of them died from asphyxia from the fentanyl because they couldn't get to them in time to help them, or didn't have enough equipment or personnel or whatever. I mean, you can imagine when minutes are ticking by, and I'm talking about 2 or 3 minutes, how are you going to take care of 500 people? How are you going to have the medical wherewithal to do that? You don't. So, but that's how quick fentanyl works. And it's unfortunately ready available. You can find it, you can buy it on the street, probably on, any street.
So what would the victim's symptoms face, and then what would the forensic evidence?
Well,
prepare?
the victims would the first thing they would notice is they'd become short of breath and dizzy. And this would last a very brief time, and then they would lose consciousness and they'd be gone. They'd be out. And pretty soon they would quit breathing because it's a powerful narcotic that shuts down the respiratory center in the base of the brain, actually in the upper part of the spinal column. And it shuts down the respiratory center, so you stop breathing and you die of asphyxia, just like a heroin overdose or a morphine overdose is the same thing. This is about 300 times more powerful than heroin. So that's what makes fentanyl so dangerous. That's basically what they would do. They get dizzy, short of breath, maybe chest pain, collapse, gone. And this would happen literally in a minute. Depending on the dosage and the route of administration. And so if somebody isn't around to save them, somebody doesn't have Narcan, somebody doesn't know how to do respirations. If you do respirations, you can keep them alive until they get Narcan. But if you don't know how to do all that, there's not anybody around to witness it for a few minutes, game over. Fentanyl doesn't really show up on a normal drug screen. So you'd have to think about it. It's not like a narcotic or alcohol or amphetamines that show up on a drug screen, but fentanyl is now so ubiquitous and everybody knows about it that they often will test for that if there's any suspicion of a sudden death that they think any kind of drug might have been involved. If they don't think so, then it may just, again, it's like the blues. It's all context. The person's 75-year-old with heart disease and they find him dead in his living room. They're going to say, well, he had too much Digitoxin. He had a heart attack or he had a stroke or he had an arrhythmia or, and they don't look for it.
Hey, Doug. So Dorothy Ann has her hand up, and then Mary Lou, you're next.
Okay.
Dorothy
Ann, lock and load. How you doing?
Hey, I'm good.
Long time no see.
About bloody words years and years ago.
Yes.
Yeah. I was so sorry that didn't work out, and I was really hoping to have you.
Me too. I want to see Nova Scotia. Go ahead.
Yeah, I'm actually in BC today because I'm babysitting my son's cat. So anyway, so I'm writing historical fiction about a psychiatric hospital in 1946, 47.
Okay.
And I want somebody to die there in a convincing sort of way. Would you have any idea about the best way to do that?
Well, shoot them. But
no, we don't have guns in Canada. We don't use guns up here.
Oh, that's what's wrong. Okay. Well, I mean, any kind of the circumstance again. Who wants this person dead?
Well, it's going to be a mystery around. Well, there are all these dangerous things. Like they're treating with insulin shock therapy, for example, which can kill people quite easily.
So you got insulin.
Yeah, so he got insulin, but I was thinking more of a resident of the care center, something that they could
Okay.
have access to that might.
So somebody in the facility is
Yeah.
going to kill another person in the facility,
Yes.
and you want the death to look like a natural event.
Well, something not so easily determined, right? Because
You know,
otherwise,
but I mean, the death will be suspicious, so they will look.
yeah.
Um, well, there were some major tranquilizers around that time in the late 40s. I want to say Haldol was
Yeah,
around.
Haldol's great. Yeah.
Yeah, and I want to say that Thorazine might have been around then.
I think so. Yeah.
It certainly was by the 60s, but I think they were both around at that time, and they're very powerful. They're
Yeah.
very, very powerful. Um, and so if someone can get any one of those and get it, either one of those and get it into the person's drink or food or something, then they could easily overdose. And again, what would happen is they would go out, become unconscious and stop breathing and die.
Okay.
And back then, the testing, the toxicological testing was pretty rudimentary.
Yeah.
We could find a few things, but it's not like it is now,
Right.
you know, where you can find anything if you look for it and if it's present, you can find it. But not so much, not so much now. But both of those drugs would make the person sleepy and unbalanced and uh, poor coordination. You know, they could injure themselves, or they could just die from the drug itself. So,
Okay.
and those were very common in psychiatric institutions, obviously.
Yes, they were. Yeah.
Yeah,
Right.
Haldol was used mainly for also alcohol withdrawal. That was huge for that back then. Yeah.
Yeah, I've seen its effects too. It's a horrible, horrible drug, but
It is. That's pretty much all we had. And even when I was in medical school in the 60s and 70s, Haldol was used all the time. We got
Yeah.
better stuff now, but back then there wasn't all that much.
no. No,
Yeah.
well, thanks. Thanks for the
Yes.
inspiration. Appreciate
Yeah.
it. Good to see you.
It's nothing like murder in an insane asylum, you know, to make Saturday. All right, Mary Lou, you got a question?
So it's the early oh, sorry, I got distracted by my hand. It's the early 1970s over in Lyon, France, Lyon.
Yeah.
And the Police des Nationale or Judiciaire does not have the DNA to detect the almond scent from cyanide poisoning.
Okay.
So
What she means, it's about a 50-50 thing as to whether someone can smell the almond scent of cyanide in a body. And it's 50-50 about, so you either have the genetic ability to do it or you don't. Yeah.
to learn that. Thank you from your Criminal Mischief podcast, which I've listened to a zillion times, and I encourage everyone to. And so a cyanide poisoning of a 12-year-old boy,
Mm-hmm.
how long would it take? From what I've read thus far, Doug, it would mimic a heart attack, but we're talking about a 12-year-old boy.
Yep. It does mimic a heart attack, but in a 12-year-old, that always brings questions. Basically, it's a lot like fentanyl in that, except it works by a whole different mechanism, but you get chest pain, short of breath, collapse, and die. And even breathing for you won't save you from cyanide. You have to have the proper medications and you have to get them going immediately, because what cyanide does is it works on what's called the cytochromes inside the cells, and they shut down the cell's ability to use oxygen, and the cells throughout the body start dying immediately. And so cyanide is extremely deadly, in small doses too. And you can buy it online. So there is that, because it's used in metal plating and jewelry making and all that.
Exactly.
You can buy it online. It's really crazy.
Metallurgy, yeah.
Yeah. So when a 12-year-old just dropped dead, obviously there's a lot of questions. So now they're trying to figure out in the 70s again, they don't have a lot of toxicology and they don't have a lot of stuff. And they could probably find cyanide if they look for it. Well, what would make them look for it? When someone bleeds, say the kid fell and hit his head, and the blood that comes out is red. But with cyanide, it's very bright red.
Cherry red.
Cherry red is what they call it, but it's very bright red. It's to the point that it's noticeable most of the time. It's like, whoa. Okay. Also, the skin color can be a little red. And when they do the autopsy, the internal organs can be a little redder than usual because this cyanohemoglobin is much brighter red than regular hemoglobin, just oxygenated, what we call oxyhemoglobin. Also, if the person has laid there for a while and has developed lividity, and that's the bluish gray settling of the blood according to gravity. If you're laying on your back and it starts immediately, but it takes like 2 or 3 hours to be visible, and you start seeing the blue gray of what they call the dependent tissues. So if you're laying on your back, it'd be along the back, and if you hung yourself, it'd be in your lower arms and your lower body and legs, that kind of thing. And this is the settling of the blood, and it creates a dusky, dark, purplish, bluish, grayish tinge to the skin. Looks like bruising. Okay, with cyanide, that is pink because the blood's so bright red. So if you saw pinkish lividity, or if you saw bright red blood, or at autopsy bright red, or now they're going to consider cyanide. And then they're going to start thinking, well, okay, who would give this kid cyanide and where would they get it? And then the rest of the story goes from there.
So even in the 1970s, it would be something, I wouldn't even say, I don't even know, obviously.
Oh, yeah. You'd think of cyanide for sure.
Okay.
Yeah.
All right.
But
Thank
with
you so
kids,
much.
they die of other things too. You'd have to make sure he didn't have a congenital heart problem. You'd have to make sure he didn't get into the medicine cabinet and swallow a bunch of crap that he shouldn't, because kids do stupid stuff. You got to make sure he didn't fall and hit his head and have a bleed in his brain. I mean, there's all kinds of things that you have to look at when the 12-year-old dies, but it's probably not going to be a heart attack or a stroke.
Yeah, he drank a cherry Coke from not a very nice man.
Apparently not a very nice man.
Yes. Nice
And the
haircut.
cherry Coke won't make your blood cherry red.
Right. But I did that to emphasize,
Yeah.
to counteract the scent of the
Yeah.
almond. And
Yeah.
to tie it into the color.
And that's kind of overplayed. It's not that you can't always smell that. And even if you have the genetic predisposition, it's not pronounced. But the point is that it would only take a few grains of cyanide in that cherry Coke to take him out. It wouldn't take much. He wouldn't know it was there.
And how long would it take?
Oh, it could take anywhere from a couple of minutes to 20 minutes, depending on dose and et cetera. Yeah.
Thank you. Nice haircut.
I did it myself.
You got a lot of questions with a lot of people's hands raised.
Okay, go.
So like this, I'm going to say Kay, then Barbara, then Terry, then Michael. There's the order of appearance.
All right. Okay, lock and load.
Okay, I have two different storylines going here. One is sort of a memoir type thing, and the other is a story about a little girl about 4 years old who goes missing on a lake. How would her body not be found? Because I would think that if a child goes missing on a lake, they would drag the lake, the body would afloat eventually because of the gases and everything. So how could I explain the body not being found, not discoverable? Like it's not there.
Well, in a lake, I mean, there's all kinds of ways. I mean, a body could get, remember the marine mammals go in there and fish and stuff will eat the body eventually, but also bodies do sink initially. And then when they decompose, and this depends upon the temperature of the water. Remember, it took Lacey Peterson 3 months to come up. Why? Because the San Francisco Bay is very cold. That's cold water. And the colder the water, the slower the bacteria work and the slower the gas accumulates, both in the abdomen and in the tissues. And so the longer delay it is before the body will float. Plus, bodies get hung up. They sink down to the bottom, they get underneath some debris, they get underneath some old tree trunks and something, and they may stay down there and never come up until they're consumed. by the fish, because the fish are hungry and they're going to eat, and then just bones are left down there in the mud. So the body may never come. Then there's also currents, even in lakes. Lakes have inflows and outflows. And so it can get caught in the current and you're looking for it here and it's 40 miles away, because there's currents that run through lakes. So, I mean, there's a million reasons not to find it. And one of them is, well, it's not there. They put it somewhere else.
Okay, kind of related to that, say the person who was supposed to be tending to the child while the child's parents were away, they appear slightly intoxicated when the police arrive. Would they be taken into custody?
Well, they wouldn't really have probable cause unless they found some evidence of trauma, like blood or something, or on him, so that they might detain him to ask him questions and invite him down to the station for a chit chat, But I'm not sure they could charge him with murder or kidnapping or anything like that just based on this young child's missing and they were taking care of him. Would they be the primary suspect? You bet. Because they're there on the location. They're responsible for the child. They're the overseer. They're the ones with access. Parents are gone. Nobody else is around. Duh. They're going to be the primary suspect, but it doesn't mean they could put cuffs on them. And they could refuse to talk. So I'm not going to talk to you. I have nothing to say. I don't know what happened. And that, well, sir, don't you want to find the child? We need your help. Well, I'm not going to tell you. I don't trust you. This happens all the time.
Also, would it be, if they were charged with something, would it be like negligent homicide or?
Well, that depends on the circumstances. It could be some form of negligent manslaughter or something. Homicide, it implies an active event that they would have had to done something to the child. But if they just ignored the child and the child went off and drowned in a lake, I mean, that's not going to get to the level of homicide. But there will be charges probably.
Okay. And if their blood alcohol is quite high.
Yep.
Okay.
That would feed into the negligence. It also would feed into poor judgment. And who knows, if they're a mean drunk, it might feed into the fact that they hit the kid in the head with a hammer, because drunks get mad sometimes. There's happy drunks and there's mean drunks, and we don't know.
And one other question, more toward the memoirish type thing. How is the stroke undetected by multiple MRIs? I get that it would be diagnosed by the presentation of other symptoms,
How is what?
If a person has what is suspected to be a stroke and
Yeah.
they have multiple CTs, how is that is it possible for that portion of the brain that was affected
No.
to never be?
Now, by definition, if someone had a stroke, not a TIA, which is a different animal, but if someone had a stroke, by definition, part of the brain has been damaged, and an MRI will see that in a New York minute.
Okay.
It won't miss it.
Okay. Thank you.
Yeah.
I'm sure I'll think of more things.
Who's next? John?
I think it's Barbara.
Okay, Barbara, go.
Can you hear me?
Yeah,
We
it's
can hear
Barbara,
you.
then Terry, then Michael.
Okay.
Okay, thank you. Mine is more a cautionary tale than a question. Doug, years ago, you had helped me with making sure that the victim and the description was accurate. I had described her as being felled and killed by an arrow for a crossbow.
Mm-hmm.
And you said, no, first of all, it's a bolt. And you also described the body and how there wouldn't necessarily be blood, pouring out, but it would be more contained with the thickness. I mean, you gave me excellent information. The cautionary tale comes in when I did a rewrite of that scene and I added all those juicy facts and it was great, except I was writing it from the point of view of my protagonist, Mary Holiday, and she wouldn't have known those terms.
Right.
So how do we as writers impart this information when it wouldn't be known? If we know it as the authors, you've told us we're great, we're good to go, but our protagonist, our character doesn't know
Well,
that.
Well, I think that's a great point, and I think it's great in storytelling. Remember, it's not your story; it's the character's story, and so whatever the character knows, thinks, believes, however they talk, whatever they believe to be true, and whatever they call something, whether if it's a widget or a thingamajig, you know, is within their vocabulary and within their wheelhouse and within their understanding. So, if she said we were shot with an arrow, okay, fine. Most people would say that. Fine, that was an arrow. It happened to be a crossbow, but crossbows shoot arrows. They do shoot arrows, but they also shoot bolts, which is usually what it's called. And so somebody could correct her later. So, well, that technically that's not what it was. The medical examiner could say that. But just because she doesn't know what to call it doesn't negate the truism that's there. So yeah, you're muted.
Yeah, and that's how I did solve it.
Yeah.
I had some of the police correct her later.
Yeah, cool. Excellent. You did good. Terry?
I've got an open-ended question.
Uh-oh.
What's the least amount of damage you could do to a person that would kill him?
The least amount.
Yep.
Well, the least amount of damage you could do is probably do something to their spinal cord, the neck, break their neck, or stick a knitting needle between, between the vertebrae and the back. That would be the least amount of damage, and it would be very deadly very quickly. Also, the whole thing about hitting them in the nose and driving the bone into the brain, that's more myth than real, but it is doable, absolutely, and it's happened. And a blow to the head can sometimes cause bleeding into the brain that kills you pretty quickly and have no external signs at all, not really leave a bruise or a skull fracture or really anything, because the person died so quickly it wasn't time for a bruise to form. And the skull does not have to fracture for the brain to get really hammered. So those would be pretty simple. I mean, it's amazing how many people get gunshot wounds and they don't know they've been shot for a while, because there's not a lot of external bleeding. The bullet goes in, leaves a little hole, and if it's to the heart, say it, and it sets, and the heart suddenly stops. It doesn't always do that with a gunshot. Dead people don't bleed, so when the heart stops, there's no pushing of the blood forward, so you're not going to bleed. The amount of blood that comes out of the wound is negligible. And so it's amazing how people get shot. It's like the old thing about an emergency room, always roll the patient over. Who knows? There might be an arrow in their back. You're sitting the ER doc and you're working on the patient that's laying there. Well, look at the backside. If you can't figure out what's going on, maybe you're not looking in the right spot. And that's an old medical adage. Turn the patient over and look for the arrow, So all those things would be minimal damage, if you will, and could still kill pretty quickly.
Outstanding. Thank you.
Michael?
All right. I'm kind of going down the same path as Terry.
I wouldn't do that.
Yeah, I know, right?
Terry's dangerous.
We only need one Terry Black in the world. So I've got a short story where I've got an evil magician.
Of course.
I want to know, how many body parts can you sever without killing someone?
Oh, a lot.
So I know, like, if you chop off the little finger, if I guess the forensics standpoint or the symptoms, if you chop off the finger, the muscle's going to constrict around it and reduce the blood flow. At least that is potentially the myth, or
yeah, no, you can do that.
So then, how far up on the hands, or how many digits can you?
All of them.
Okay.
And the arm and the legs.
Wow. Okay.
Didn't you see what was that movie where the guy kept cutting off body parts of who was the actress that started that? I forget.
I don't remember.
Huh?
No, RoboCop did that. It was a terrible scene.
Yeah.
Now, this was a movie where a doctor had kidnapped this woman and started cutting off parts, and she ended up basically as a torso and a head, and a neck, and was alive. So, it's like surgery. They amputate things all the time, and if you control the bleeding and sew it up, and to prevent infection and give them IV fluids and feed them and do all that stuff in between all these procedures, you can pretty much take most of the body away.
So
You get the vital organs.
So then, that old magic trick where you put your finger in the little, or the carrot in the little chopping block. So would it have to be just a very sharp blade?
Well, yeah, sharper's better. It's easy to cut with a sharp knife, but yeah, I mean, you can do that. You can take a cigar cutter and cut somebody's finger off with enough force.
Barbara's saying we're done with that question.
Yeah, or use plant shears, or I mean, there's a million ways to do it. This is pretty gruesome, but that's the way it is. But you can just continue removing parts as long as they don't bleed to death, go into shock, or get infected. If it's a long-term process, then you can remove all the extremities.
Okay.
Yeah.
It was a short story, so it'd be just a few body parts.
Oh, there's just a few parts in a short story then. A novel, we get lots of parts removed.
Exactly.
That movie is
I got a quick question, because there's always there's always this thing that always happens in mysteries, and I don't understand why they do it, because like you said, corpses don't bleed. So when they hit somebody on the back of the head, and that's like the death blow, and then they try to put the gun to their head and then commit suicide, and then people walk in and are like, oh, they must have shot themselves. I mean, the amount of blood you would look at would be very minimal. Why do they keep trying to do that when somebody with some capacity would realize, well, they didn't blow their brains out to kill themselves because there's not enough blood?
Well, if the person was just unconscious and still alive, then it would be the same as if they did that. But now you start looking at angle and position and gunshot residue and right hand, left hand, all this kind of stuff, even though right-handed people shoot themselves with their left hand too. But so that's not universal. Mostly it's the dominant hand that you're going to shoot the gun with. In the famous Kurt Cobain case, when they found him, he was behind the house. They had a room above the garage, the house there in the Seattle area. And they found him laying on his back with a shotgun on his chest and his brains blown out, but he also had heroin paraphernalia and heroin in his system. So they're saying, that it's a suicide. And that was the final ultimate ruling, that it was a suicide. Okay, fine. Drug addicts do that all the time. And Kurt was a drug addict. A lot of people raised controversies about this, that, and the other. One of them was that the shotgun was laying upside down. So the trigger guard was up. And my thing is, well, how else would you do it? Anybody who knows anything about shotguns and the shape of them, if you turn the shotgun this way where the trigger guard's down, you got to get your thumb in there between the gang thing. Plus the angle's different because the way the gun is shaped, it's not just a straight barrel, it comes down for the stock. I grew up hunting. I know about all that. Turn it upside down. Put it under your chin, you're laying there, you use your thumb and you pull the trigger. Duh, that's the simple way to do it, okay? Here's the problem. When they found him, and this is one of the controversies that's gone on in this case that goes on to today, shotguns, when they're automatic, like this one was, will eject the shell and seat the next one. Now, and only automatic shotguns will do that. If you have a pump or something else, there's an active process. But automatics, like Browning automatics, will do this when you're ready. The next one is seated and ready to go. The ejection port is to the right, because most shotguns are made for right-handed people. You're shooting, you want the shell to go out this way. You don't want to come back and hit you in the face. Here, bang, shell should go this way. The shell was found over here. How'd that happen? Don't know, unless somebody moved it. The other thing, and the other big controversy there, was that the level of heroin, actually it's apomorphine that they test for, but the level of heroin basically in his system was very high. And one group of toxicologists are saying, no, he would have been too impaired to operate a shotgun. Well, it doesn't take much to operate a shotgun. And the other group says, no, this guy was a full-on heroin addict. He could tolerate a lot more heroin than the average Joe. And so he could absolutely have functioned at those levels. Well, that controversy is still going on. But Courtney was in LA, so she didn't do it. So yeah, the real life. What else we got?
It looks
Yes,
like
Okay.
the
Mary
movie
Lou-
with Boxing Helena. You're right.
So it looks like Mary Lou and then Dorothy Ann with 2 questions. So Mary Lou,
Okay.
go ahead.
I just have, thanks, John. For a very brief discussion point, it seems like pregnant women are extremely vulnerable
You think?
in terms of crimes committed to
It's
them.
the most
by
common
people-
cause of death in a pregnant woman is homicide.
That's just sent chills down my spine.
Well, it's true.
It's amazing.
It's
I
true.
just,
200 years ago it was childbirth. But now it's homicide. Yeah.
okay.
Yep.
Gotta love what's happening to women these days. Anyway, I just
Most of
wanna-
them are writing novels, very good novels. So.
well, the ones who live, yeah.
Yeah.
The dead ones, not so much. Just a quick follow-up question about my psychiatric hospital.
Yeah.
So they're doing ECT there, but it's early ECT, right?
Mhm.
So it's
Yep.
before they actually, I remember seeing ECT when I was in nursing school, and it was pretty
Mhm.
horrific even then, and that was in the 70s. What would happen if someone mismanaged that? Would that
Mhm.
like too much?
Yeah. You can actually, do permanent brain damage if there's too much electricity that flows through there. You can also cause changes in the cardiac rhythm, and people can die. And that's why, when they did them, they had crash carts and stuff around, to do CPR in case something went wrong. And then, usually he put a bite block in the mouth so they won't bite their tongue and stuff like that because it causes seizures.
Mm.
In all honesty, it's probably safer than the insulin version.
Yeah.
Because insulin, or convulsive therapy, around but convulsive therapy is, you drop the blood sugar so low that the brain seizes. Well, by definition, you're going to lose some brain cells, but you're probably going to lose some with electrical also.
Yeah.
Like you, I saw one. I said, that's enough. I don't want to see this anymore. But it's also interesting that in the past 10 or 15 years, ECT is making a comeback because it works.
Yeah, it has been shown to work.
It
with
has
depression,
for severe clinical depression, it is about 90% effective in improving that for at least a period of time, and sometimes for a couple of years. I guess people are afraid to complain if you're going to shock their brain. Never mind. I'm having a good day. I'm really feeling good about myself. Don't put those paddles on my head again. But the point is that as brutal as it is, it does help.
So
And sometimes it significantly so.
yeah, so the insulin, from what I've read about the insulin shock therapy, they used to lower till you seized, but then they would sort of leave you at that hypoglycemic state for quite a long period of time.
Yeah.
And they would do it repeatedly over,
Yep.
8 or 9 weeks.
It's like trying to reboot your computer,
Yeah.
with a hammer, Yeah, just push the little button and wait a minute.
Unplug it and plug it back in.
Yeah. And that's basically what these things do, is reprogram the computer.
Right. It seemed to
That's
me like
kinda
a
what
really
it does.
dangerous way to go about things, but
Yep. You do what you do. And we're going to look back in 500 years and they're going to say, they used to saw people's chest open and sew in veins they took out of their legs to bypass stuff. And all you had to do was take this pill, it's, or get Scotty to, or Doc to wave that thing over the bones, to wave that thing over you, in Star Wars. So yeah, I mean, if you go back through medical history, the things that were done are absolutely brutal.
yeah,
You
I
know,
just finished writing
but it's all there was.
Yeah,
It's all
I
there
read about
was.
the
You had no
PD
other
sanatoriums,
options.
and they were terrible. They used to have to slice and dice people for hours. It's like,
Yep. Yep.
Thousands of julienne fries in seconds, as they used to say. But
Yep.
but thanks. So you would think that the insulin is more dangerous than the ECT.
You know, I don't have any data on that I could say, and it's kind of out of my field, but it makes more sense to me. The ECT is a bang done, and insulin, when you get it low enough to cause a seizure, you know, by definition, and I can think of my patients that I had way back in the 60s and 70s in medical school, and that they would get hypoglycemic and have seizures and stuff. They were never the brightest people.
Right.
You know, they just they didn't come out of that as smart as they went in. Let's put it that way. Yeah.
Thanks.
All righty. So I got another question for you. How long would a bruise show up on a dead body? Like what's the timeline of the physical elements?
You mean a bruise that happened and then the person died?
Yeah.
It'd stay there until the body decayed, because again, there's no blood flow. You know, bruises disappear by two mechanisms, really. A bruise is where you get whacked and it breaks the capillaries and blood seeps out into the tissues. That's it. That's a bruise. Or we call them contusions, but that's a bruise. And so now you've got this blood material that's in the tissues outside the vascular system. Over time, because there's blood flow through there, cells come, macrophages, they come and eat up all the proteins and hemoglobins and stuff and remove them. Plus chemical reactions are going on, and you had a bruise. It turns bluish, then it turns darker and gets more purple, and then it starts fading, and then it gets a little grayish, and then it turns yellowish, and then it turns greenish, and then it disappears. And that's all from breakdown of the hemoglobin chemically. But then the phagocytes have to come in and remove all that stuff. And that takes 2 or 3 weeks for the average bruise to completely disappear. But if you die and there's no blood flow and there's no cells marching around and they're doing their job, the bruise will stay there until the tissues decay. Can you bruise a dead body? Well, you can, but it takes a hell of a blow. And the coroner, if they go in there and dissect the tissues and look at it microscopically, can usually tell the difference. So.
All right, cool, thanks.
Yeah.
Hey, Kay, you had your hand up. You still have a question?
No, it just kind of popped out of my head. It'll pop back in. Don't worry.
I know that feeling all too well. What did I walk in this room for? It was very important, I know.
Can I show off 2 things?
Yes. I know those books.
These
I
are
like the new
super-
cover for Forensics for Dummies that they changed about 2/3 the way through the run so far. That went from the yellow, all yellow and black, to the adding the blue. And
So these are
that's
2
pretty cool.
of Doug's books that I found very helpful. And
I did
can
too.
I'm sure you did.
Well, the How Done It series, the black and gray with that one. There's actually 3 books in that series now. This series used to have like a dozen books in it, and I'm gonna tell you, most of them were terrible. They were terrible. They were fluff and shallow and stupid. Sarita Stevens wrote the one on poisons in the original series, and it was great. So when they wanted to revamp this series, I don't know, 10 or 12 years ago, they asked me to do this one. They asked Lee Laughlin to do the one on police procedure, and they asked Sarita to update her book on poison. So now there's 3 in that series. And if you write crime fiction, all 3 of those books should be on your shelf, because you can quickly look up stuff. But it's the How Done It series from Writer's Digest Books, which doesn't exist anymore. I think, was it Putnam bought them? I can't remember. They send me a check every now and then. That's all I know.
So
I don't-
Doug, can you repeat the 2 other authors? Lee.
Sarita Stevens, and the other is Lee Laughlin.
Laughlin.
Yeah.
And he did police procedure.
He did police procedure, but you can go online and just say How Done It series, and they'll all pop up.
Okay. Thank you. Just letting everybody know these have been super helpful to me.
Yep, they're on our bookshelf.
Yeah, well, I threatened you guys, you know, and
We helped build your house.
yeah.
Yeah.
Okay.
Purchasing
Who else?
What else we got? Uh-oh, Kathy, we're in trouble now.
I know. And I had to step away for a family emergency, but I'm back. Everything's fine. But so I hope you haven't already answered this, but can you really get rid of a body by having pigs eat it?
Sure.
They do, they eat
Pigs,
everything?
pigs will eat anything.
Okay.
Pigs will eat anything. And pigs are very smart. They're very fast. They're very strong. And
Do you have to
they're,
chop it up first?
no, they'll take care of it. They're omnivores. They will eat anything. Plants, grubs, people, babies, remember was it Grapes of Wrath where the pig ate the baby? Um, in the South, we used to have, and I think they do in the Midwest too, you'd get feral pigs, they would pack together. Right. They would escape from farms. And then they would get together and form a little club, and they'd be running around in the woods. And they were very dangerous, very dangerous. They would if they went into a chicken house, they could decimate a chicken house in 30 minutes. Wow. Eat them all. They would take down baby calves. They probably couldn't take down a whole cow, but calves, fair game, baby. Dogs, cats, puppies, children. Yeah. And they become, and when they get a big enough nuisance, and the farmers would get together and go after them and track them down and kill them. But otherwise, if there was just a few of them and they were just a little mischievous, I'd leave them alone. But when they became dangerous, and it happens all the time, and it still happens, because
in California we would have wild boar.
Wild boar, exactly.
Like recently, like people
I know.
Hiding on top of their car hoods because they couldn't get away from a pack of boar.
Well, they had bubonic plague up in Washington State, so what goes around comes around,
Hey, Katie, you remember your question? Go ahead.
Yes, it came back to me.
Okay, good.
So, you've seen on television shows or in movies or maybe read in a book about people who are mistakenly presumed dead and they're buried alive.
Mm-hmm.
Anything that could make a person seem dead?
Oh, absolutely. Absolutely. The tetrodotoxin would be the one. There's also other toxins in that class, saxitoxin and stuff like this. Tetrodotoxin is fascinating. It's a neural toxin in that it kind of shuts down activity of the nervous system. It is the chemical that's found in the Japanese delicacy called fugu, or whatever they call it, Fugu. I can't do it. And every now and then you'll read about a bunch of people dying in a Japanese restaurant from eating this stuff. And it's because the chef screwed up. And the chefs have to train for years, and they're actually licensed before they can prepare and serve this dish. And what happens is they leave behind just enough of the toxin, and it takes special techniques to prepare this thing, and it takes hours, just enough to give you a buzz, make you feel a little warm and fuzzy and a little jumpy and a little this and a little of that. It's kind of like the things that people will do. And so every now and then you see that. Now, it comes from the puffer fish or the blowfish. And there's also, like, the California newt has, I think, saxitoxin, which is still in the family. The blue ring octopus also has a toxin like this, how it kills its prey. But it's also in zombie powder. Now you're going to say, oh, come on. No, it's real. And I can tell you where to get it. When you go to New Orleans next time, and you're drinking in the quarter, go over and walk by the Mississippi River down there toward the casino and that little area and look across. What you see on the other side is Algiers. In Algiers, you can find zombie powder because this voodoo is huge over there. It's also huge in Haiti. I found out about this in the 70s when I had a patient. I'll call him Jim because that was his name. He came into the office and he was having some heart issues and stuff, but he told me this tale. And he said, I was in Haiti and they ended up putting zombie powder in my shoes. And I'm thinking, okay, we need a psych consult. And he said he owned a truck axle factory, and baby Doc Duvalier wanted that factory, and Jim refused to sell it to him. So he sent his Tauntaun Makut goons over, and they snuck into his house one night and actually put some tetrodotoxin powder in his shoes. He gets up in the morning, slips his shoes on, sits down to have breakfast, and doesn't remember anything for 3 days. And he woke up in a 400-year-old prison laying on a mat with a rat chewing on his feet. Now, it took the State Department several weeks to get him out. He ended up going on Nightline and ABC News and all this stuff. Well, I mean, he's telling this tale, and he actually brought in some incredible pen and ink drawings of his ordeal that he had made from what he could remember. This guy was a great artist. I've got several of his things he gave me, and before he disappeared, and he moved somewhere else, and I lost track of him. So anyway, make a long story short, I found Dr. Wade Davis at Harvard and their ethnobotany, director of the ethnobotany thing, and he made the movie The Serpent and the Rainbow. Okay. And so I called him and I said, come on, tell me the story here. He said, oh, I'm familiar with that case. He said, absolutely, it's real. Absolutely, it's real. And what they do to make zombies, which are good field workers because they don't complain, is they will give them this. And what happens is your blood pressure falls to about 60, your heart rate goes down to about 20, and it lasts for anywhere from 12 to 36 hours. And they take you out and lay you in a field and cover you up with leaves. And they come back a day later and brush the leaves off and pick you up. And what's happened is you've had a anoxic encephalopathy, a frontal lobotomy. Think Jack Nicholson in Cuckoo's Nest. They did a surgical lobotomy, but this is an oxygen deprivation. Again, we go back to the insulin treatment for ECT. This is the danger. So they're very flat faced. They walk, in a shuffle, but they work in the field. And so that's how they made zombies. And this happened in Haiti, and this is real, and it's absolutely real. So the point is, if someone has this on board and it's given to them, their blood pressure's very low, their heart rate's very low, and it may be hard to detect unless you hook them up to an EKG or something like that. You may feel for a pulse and not feel one and think that they're dead. So absolutely, that can happen. Now, someone can go into shock from an infection and all that stuff and do the same thing, even though infections usually have fevers. Once you go into shock and your blood pressure falls down in the 60s, not much blood gets to the skin because the body's going to redistribute it to where it's needed the most, which is like the brain and the heart, And so there's less is going to go to the skin. So the skin will feel cool, even though your temperature is 104. So that's just basic physiology. So yeah, all those things will work. They'll do that. And narcotics, same way. People can take enough narcotics that their heart rate and blood pressure and breathing are so slow that they look and feel dead. They don't respond. They feel cool. And I can't find a pulse. Well, this person's dead. And of course, then they take them somewhere and take them to the morgue and they wake up screaming, which pretty much ruin your night.
In their chest.
So as we kind of wrap up here real fast, I'll let you know that Columbo did an actual episode on fugu poisoning where that was the matter of thing. And that is the only meal that the Japanese emperor is never allowed to eat. Allowed to have fugu fish. And I've seen it. I've been to Japan 3 times and I've seen it, and it's everywhere. You go to Osaka, you go to you'll see it everywhere. And it's supposed to be a delicatessen, but my wife and I have not divin into.
No. I don't eat raw fish anyway.
But yeah, it's everywhere. So
how long has that been around, that knowledge, that kind of voodoo drug from these poisons?
I've just been around, they use it in Haiti probably for 100 years. I don't know. It doesn't mean that they understood the physiology and what was really going on. It was like empiric to them, this worked, let's do that. Which is what how most of medicine started. It was, you see it, you observe it, you repeat it. It happened again. Oh, okay. This is pretty cool. It goes back to Aristotle.
So we don't know if it was around like in Asia, Eastern culture 1,000 years ago. We don't
know that. But if you wanted to, you could.
Okay.
If you're writing a novel, it could absolutely be there. Remember, it's only got to be believable, not true.
Absolutely.
I mean, we bought Star Wars, you know.
Right.
Well, I gotta say, Doug, this has been fantastic.
Well, good.
We're gonna have more of these, so people can come back on and do it. But make sure that you follow us on Eventbrite and Outliers Book Club on Facebook and all over, because when we post these events, you'll know it first up.
Yeah, this will be on our YouTube channel, along with all of our interviews and all the other stuff. And I'm gonna tell you, we've done several interviews, and you absolutely have to go to our YouTube channel and go to the Get to Know series, where we interview people and watch the D. Snyder interview.
Mhm.
D of Twisted Sister. He was outstanding. He was outstanding. But all of them have been good.
So make sure you check that out. So we want to thank Doug and everybody for coming on and joining. Like I said, we'll do more of these coming in the future.
Yeah.
So yeah.
Can I ask a question? If there's things that you guys want to hear about, and these kind of things, where you'd like to hear from somebody on a certain topic or whatever, let us know, and we'll try to see what we can do with that. We love suggestions.
Absolutely. Just send it to support@outlierswritinguniversity.com. All your emails can go there. So support@outlierswritinguniversity.com is the place to go.
And
Just
check
go
out
back
Outliers
to
Writing University. Become an
Yeah.
outlier with us.
Yeah.
I'm an outlier.
Yeah.
All right. Well, Doug,
All right.
hey,
Thank you, guys.
man.
Great questions. Thanks.
Yeah, it's fantastic.
Now get to writing.